Hello everyone, this is Nahala Hamouda from the College of Pharmacy, Rizmikhan University. In this video, I'm going to talk about pharmacotherapy in lactation. It's closely related to the previous video about pharmacotherapy in pregnancy. First, I want to remind you again, as a pharmacist, before prescribing any drug to a female patient, you have to ask her two questions. Are you pregnant or expecting pregnancy? And are you a lactating mother? Please don't hesitate to ask your female patient these questions. Okay, next, first, let us explain what is lactation. Lactation is the scientific term. We usually call it nursing. So what is lactation or nursing? Is suckling of breast milk by the baby. Where did this breast milk come from? The breast milk is a special type of body secretion from the mammary glands in the nursing mothers. Regarding its body secretion, so you can understand it is like an extract from the blood, and it's secreted from the mammary gland by the effect of prolactin hormone, which is released from the posterior lobe of the pituitary gland. Nearly all drugs can transfer from the breast milk to some extent. As I said, it's a body secretion, so it's an extraction from the blood. So any contents in the blood can pass through the breast milk. What are the effects of drugs in nursing infants depends on what are the factors affecting. First, the transfer of drug into the breast milk. According to the dose, if there is a big dose, then you can expect higher amount of drug crossing into the breast milk. Number two, amount of breast milk consumed by the infant. For example, if this infant is suckling like 5 times a day, dose of drug received by him will not be the same like a baby only suckling 2 times a day. So this is the amount of breast milk. Number three, the condition of the infant himself. Is he premature in the first week of life? Is he healthy or ill? For example, if he is premature, then his liver is not working properly, so he cannot metabolize the drug. So we can expect higher side effects. Or he is healthy, he is in good condition, he is a full-term baby, so we can expect his liver is working well. And the pharmacological activity of the drug regarding its absorption, distribution, metabolism, and excretion by the infant. So, because we have many factors affecting nursing infants, the WHO has classified the drugs during breastfeeding, nearly similar to the description and classification in pregnant mothers. So, group number A, it's compatible and considered safe. There was no any theoretical contraindications to use of this drug and no any reported side effects. B, they are compatible with occasional minor side effects for the baby. In this case, we should advise the mother. If you cannot take this drug or substitute or you can stop it, please stop it. If you cannot stop it, please breastfeed your baby before you finish the dose, okay? Or you can stop breastfeeding your baby and give artificial feeding while you are taking the drug. C, avoid if possible, because they have been reported significant side effects with these drugs. Remember the risk-benefit ratio. For example, if the mother is taking anti-anxiety or antidepressive drugs, these drugs can affect the development of the central nervous system of the infant. Group D, they are absolutely contraindicated. The mother must not take these drugs. Dangerous side effects. If she has to take these drugs, then she must stop breastfeeding, like anti-cancer drugs and radioactive drugs. Okay, for a pharmacist, when prescribing and counseling your patient, what are the general considerations on how to minimize the risks of transfer of drugs through breast milk? First, if there is a topical therapy, please use it instead of the oral medication. Drugs that are safe for the infant's age can be used by the nursing mothers. For example, for infants, the best anti-fever drug is paracetamol, so the mother can safely take paracetamol. Drugs that are safe during pregnancy are not necessarily be safe during breastfeeding. Take care about this. Sometimes some drugs, they can be used during pregnancy, but cannot be used during breastfeeding because the baby pharmacodynamic parameters may not be good to excrete and metabolize the drug. While in pregnancy, metabolism happens by the mother's system, not the baby's system. So take care about this point. Next, choose the drug with the shortest half-life and highest protein binding, so the chance to be secreted in the breast milk is lower. Drugs well studied in infants before, or all the drugs. Usually, all the drugs are first to be used because they have been tried for many years, so all their side effects are very well known. Number 5, timing of breastfeeding. Feed the baby before taking the dose. Take the drug before the longest sleeping interval of the baby, example, after the bedtime feeding. For example, the mother has to take a drug every day before sleeping, so first she should breastfeed her baby his night feeding before sleeping, and then she can take the drug. So it's expected the next feeding will be in the morning. So already about half of the drug have been metabolized by her body. Okay, so these are the general considerations or counseling tips you have to say to your female lactating patient to minimize the risks of transfer of drugs to her baby. Thank you so much for listening.